guest is Dr. Priya Kansal. Nice to have you here today.
Thank you for having me.
Yeah, thanks for being here. I think this is a really important topic, one that I believe is overlooked. In fact, I did not realize that heart disease is the leading cause of death in the U.S. for women. We're going to be talking about the differences between how heart disease affects men and women, but let's just start with a lesson about heart disease, really what it is, and you actually brought a visual today. So
I did. So whenever people talk about heart disease or think about it, what they're thinking about is heart attacks. And really that's only one part of what constitutes heart disease. So when we think of heart disease, we're thinking of things like high blood pressure.
Okay.
We're thinking about hardening of arteries anywhere in the body. So if it affects the brain, that can lead to strokes. It affects the heart, that can lead to heart attacks. If it affects the lower extremities, that can lead to poor circulation, gangrene, things like that.
Okay.
In addition to that, there is a component of heart disease that's known as congestive heart failure. And that is a consequence either of high blood pressure or of prior heart attacks. So all of these things are components of heart disease.
Okay.
So the way that I think about hearts is imagined like a house.
Okay. Yeah, no, this I think is such a great way to show kind of really how the heart works and behaves.
Yeah. So heart attacks, which is what people are worried about the most, happens due to plumbing issues.
Okay.
So in the house, that is the plumbing that runs inside the walls. And here you can see it on the surface. So these are actually inside the lining of the heart. And if there is blockages in there, that can lead to heart attacks.
Okay.
Inside the heart is the walls and the doors, if you will.
Okay. Or the wiring.
The wiring's the electrical system.
Okay. Okay. Got it. All right. I'll let you just go. I'm jumping ahead.
That's all right.
Okay.
So the walls and the doors are what constitute the functional parts of the heart.
Okay.
And if there is a problem with those, that can lead to the heart functioning being abnormal.
Got it. Okay.
And then there's the electrical system, which actually you can't really see on this model because it runs inside the walls. It's usually parallel to the plumbing.
Okay.
It's important to know that it's independent of the plumbing.
Okay. Got it. Interesting. So heart disease then, let's talk about how it's different for men and women.
Sure. The big things that are different for women really has to do with how heart disease presents.
Okay.
And specifically what we're talking about is if there are blockages in the blood supply to the heart, the symptoms for that can be different for women.
Okay.
So instead of having chest pain, which only happens in about 40% of women,
Okay.
there could be shortness of breath. There could be right-sided chest pain, or there could be things like back pain or unusual fatigue. The important thing to know when we start talking about atypical symptoms is that we're still looking for a pattern.
Okay.
And that pattern is it comes on with exertion
Okay.
and it goes away with rest.
Okay.
This is really key.
Okay.
So it isn't just, oh, I was working in the garden and my back hurts now, is that my heart? No, it's a specific repetitive pattern
Okay.
that happens every single time you try to do something.
That where you're using any kind of energy.
Right.
You're having the same symptoms after.
Right.
Okay.
Yes.
Okay. So that's good to know. Oh, we have a question.
We have a question right
Sure.
off the bat.
Yeah, that's
So,
good.
Brandy
This is a good topic.
Jennings,
Yeah.
let me turn this up. Brandy Jennings would like to know if there is a test or something my doctor can do to test my heart function. She says she has 22 years of drug abuse. She's currently 89 days sober. She smokes, she's overweight, and has heart disease in her family. She's afraid she's damaged her heart, but she does not have high blood pressure.
Really good question.
Sure. So thank you for your question.
And she says she's a Kaiser patient.
Oh, good. That's good. Yeah.
So that
like
makes the
that.
answer really easy.
Yeah.
I would say
Yeah.
talk to your doctor. They're the ones who can talk through if there are any symptoms or signs of heart disease that we should be specifically paying attention to. And if everything is looking good, then they will be able to talk about what potential tests are available to look for damage that might have occurred. And congratulations for being sober for this long.
Right, yes. 89 days and
That's-
counting. That's fantastic. Well, then let's talk about, so if there's the pattern
Yes.
that you just mentioned, what
Yes.
about, okay, so when should a woman be concerned? 'Cause I guess what I'm trying to say is some women, myself included, if I'm unusually tired for whatever reason, or, if I've gone for my long walk and then I'm really tired, and I don't know if it's a pattern or not. But so when should I be concerned enough, or when should someone be concerned enough to make that call to the doctor?
So I would say if it is something that you're noticing that has been happening more than once.
Okay.
So if it's a one time, just went for a really long walk and then got really tired, that's maybe not something so much to worry about.
Okay.
But if it turns into every time I go for a walk,
Got it. Okay.
I'm having this same problem, then it's time to talk.
So you did say the repetitive nature of it, right?
Yes.
So, so that's when maybe, and then do you, like, after a month of this happening? We need a timeline.
Yes.
Doctor consults.
I would say you probably don't want to wait for longer than a month.
Okay.
So week, 2 weeks is about as long as you want to give your body to recover from unusual exertion, and if it's not happening, sooner the better that you talk to your doctor.
It's just good to know.
Yes.
Have that and really be understood.
Yes.
Okay, let's talk about risk factors. Common risk factors.
Absolutely. So there are certain risk factors that apply to all of us when we think of heart disease. And the most common ones that we think about are things like high blood pressure, diabetes, kidney disease, being overweight.
Okay.
There are lifestyle choices like smoking or being sedentary that
Sure.
are pertinent to this, as well as age and gender,
Okay.
as well as a family history. So really the ones that we can't change is how old we are, what gender we are, and what family history we bring to this.
Right.
But all the rest of the risk factors are within our control
Right.
of how we let them play out in terms of our long-term heart health.
Exactly. Okay, so that was just common risk factors for any human being. Oh, we have another question. Okay.
So,
It's
this
okay.
is
No, it's
kind of
good.
related to what you were just talking about.
Okay, sure.
And I hope I don't butcher this name. Mergan Carvandi. She asks, my BMI is high. Am I at risk of heart attack?
Good question.
Sure. So when we think of BMI, we talk in terms of the overall effect on the heart. And a high BMI can affect the heart by raising the blood pressure. Mm-hmm. It can also lead to higher blood glucose and blood cholesterol levels. So when we're thinking of heart disease, not specifically just the risk of a blockage in an artery that could lead to a heart attack, but also the overall functioning of the heart.
Right.
And so for that reason, having a healthy BMI is a long-term protective factor.
Right. Sure. And again, something that is in our control, doesn't have to do with, you're right, like age or gender or any of that. Okay, but we were talking about common risk factors just in general.
Yes.
Kind of a broad term. Let's talk about common risk factors that are specific to women.
Sure. So there are certain things that, as women, is pertinent to us. The main thing that we want to think about is the protective effect of female hormones on the body.
Okay.
These female hormones actually help the arteries stay flexible. Mm-hmm. So we're protected in some ways from the effects of high blood pressure and of that hardening of the arteries that eventually leads to blockages. That effect starts to go down once we go through menopause.
Okay.
And then the arteries will start to behave without that protective effect. So in about 10, 15 years, that protective effect will be completely lost, which is why a lot of women in their 60s and 70s will start to have high blood pressure. And they always wonder, well, I never had it before.
Right, but
that's kind of normal.
Okay.
For
But there is a
women.
silver lining, too, like having crazy hormones that we have to deal with. It's actually helping us a little? Is that what you're saying?
It is helping, definitely.
Okay, well, that's what I heard.
Yes.
Okay. Keep going. Yeah, go ahead.
The other thing that we think about is for women that have had preeclampsia during pregnancy, that is a high blood pressure that rises towards the end of pregnancy, that seems to correlate with high blood pressure later in life.
Interesting.
As well as the risk of heart disease later in life. The form that heart disease takes may differ, so it could lead to thickening of the heart walls, or it could lead to blockages. Sure. But for that reason, it's important that if you have that in your history,
keep your eye on.
Yes.
Okay.
Keep talking to your doctor.
What about other things like lupus or arthritis or that kind of thing?
Sure. So women in general suffer more with connective tissue disorders like lupus or rheumatoid arthritis, and these seem to be markers of a generalized inflammation in the body.
Okay.
And there is a subset of science that applies to heart disease that says that blockages happen because of increased inflammation.
Okay.
So not specifically that I have a joint inflamed, so I'm going to get heart disease, but it's that whole body reaction that eventually can lead to heart disease.
So again, something to be aware of.
Yes, absolutely.
That's what we're doing. We're raising awareness. This is good stuff today. So then let's talk about, you mentioned age.
Yes.
Obviously there's nothing to do about our age, but are women who are younger and mostly physically fit, is that kind of a group of women that should also still be concerned about potentially getting heart disease?
So the concept that we want to think about when we think of heart disease in women is a concept of lifetime risk. So the drawback for all of the studies that have been done looking at heart disease has to do with this model where we try to estimate the 10-year risk.
Okay.
And if you put in a 45-year-old woman who doesn't have high blood pressure, doesn't have any other heart disease,
sure,
maybe some family risk factors, their risk comes out really low on a 10-year model.
Okay.
And that gives us a false sense of security. Oh, I'm at low risk for heart disease. But when you think of the next 50 years, which in my mind is what we need to be doing, we want to keep everybody healthy for as long as we can. And when you do that, when you estimate the lifetime risk, it's that risk that goes up in their 60s and 70s.
Right, okay.
And so eventually, women are going to develop heart disease. They just do it later in life. Okay. And so by the time you're in your 60s and 70s, and now you're coming up on that 10-year risk, we've lost 20 to 30 years of work that we could have done to protect you.
Okay. So yeah, this is sort of, the next question is really about prevention, right? How are we then able to prevent getting heart disease, or at least lower our risk of getting heart disease?
Absolutely. So the big things here, as you said, we can't change our age, and we can't change who our family is.
Right. Although we wish we could sometimes.
Sometimes. So really what we're focused on is if you know that there are certain risk factors like high blood pressure or diabetes or being overweight, that we try to mitigate that as much as possible. So this concept is known as know your numbers. So knowing what's normal for blood pressure, for blood glucose, blood cholesterol, those are things that are important. Having a conversation with your doctor to make sure you're within range so that these diseases do not impact long-term health.
Got it.
The next thing has to do with what we eat and how active we are.
Okay.
And really this is the bulk of what's going to help us long-term.
Okay.
So trying to stay away from processed foods, trying to focus on fresh, healthy fruits and vegetables, trying to minimize the amount of processed, whether it's bread or meats or whatever it might be.
Whatever it is, right, okay.
And that's really what's going to help the body assimilate all the micronutrients that it needs to stay healthy long term.
Okay. All right, so this is where Haley gets honest. No. So if you live your life like this, like I do, I'm mostly a healthy person, right? I go for my walks, I eat healthy, I do stay away from processed foods. I like my glass of wine or my coffee or time to time. But I just went to Vegas for 2 days, right? I didn't eat that great. I had one too many cocktails. That's just what we do, right? Sometimes we're human, and I went on vacation. So how do I need to beat myself up? Do people need to beat themselves up for, yes, the moderation is how I live mostly. But then, we go on vacation. Can we allow ourselves a little free fun time? And am I damaging my heart by doing that?
So the key there is, as you said, moderation.
Right.
So taking a couple of days off of your regular regimen is not what's going to break the bank.
Okay.
However, having said that, I want to make sure that it's not a permission to sort of, be binge drinking, because that really can be harmful.
Well, of course, yes. And I get that. But, my question really is, can we take a vacation for a few days?
Yes.
Okay.
And that's definitely not going to break the bank.
Okay. Yeah, it's just a question. I think people sometimes do beat themselves up, like, oh,
Yes.
I overdid it. All right, this weekend I ate too much. Or
Right.
we're really hard on ourselves, I think. So the goal is to overall be healthy, eat healthy. Don't overdrink. Go for a walk, that kind of thing.
Yes.
But I do think in this society we beat ourselves up a lot too. So it's nice to just say, you know what, you can take a vacation from your life for a couple of days. Okay.
Yes.
I said it. All right. Okay. So then I do also want to talk about, you mentioned diet, and there's a new diet trend or a new exercise trend. It seems almost weekly or monthly. Are there some that you sort of approve of and that are really good for heart health? Let's start there.
So I would say that if we're looking for a specific diet that's out there that would be the most beneficial for heart health, you're probably thinking of a Mediterranean diet.
Right. Okay.
And again, the focus is lots of fresh fruits and veggies, trying to minimize the meat as much as we can, and trying to stay away from processed stuff.
Right. And the good healthy fat.
Yes.
Right. Okay.
Absolutely.
Good. This is my favorite diet, so that's good. And then what about exercise and diet trends that are potentially harmful for our heart? Let's talk about that too.
So from a long-term heart health standpoint, what we're looking for is aerobic activity.
Okay.
And as long as the heart is getting exercise such as walking, if you're doing 30 minutes of walking 7 days a week, you're getting the 150 minutes of walking that you need in order to get benefit for your heart.
Right.
So anything more than that is just additional.
It's just gravy.
Yes,
Okay.
absolutely. Some people can overdo it in terms of how much they're working out. It's important to remember that all the lifting weights and stuff like that, it's good for toning the body, but that doesn't benefit the heart long term in terms of heart health.
Okay. That was sort of my next question too about lifting
Yes.
weights. I mean, I think for strength purposes and
Yes.
to keep our bones and just kind of everything as we age, especially, but not. That's not really doing much for your heart.
Exactly.
Okay. And then, so some people, as far as how walking 30 minutes a day, but is there a certain heart rate that we need to be at, or is there a goal there that you would recommend for? Because walking for 10 minutes, just around a building, is that good enough? Just because you're doing something?
Yes, and more and more studies are showing that it is just the fact that you get up and walk.
And moving.
Really,
Good.
that is what's helpful. So for people that haven't been exercising and they're wanting to start out, I would say don't be looking for, putting money into a machine or into a membership. Just set aside 10 minutes 3 times a day and just walk.
Yeah.
And if you feel like you're able to walk at a certain pace, you can then increase the pace. We're really not looking for a certain heart rate or a certain level of activity. What I tell my patients is what's known as a perceived exertion scale.
Okay.
So if I was walking next to you, you should be able to talk to me without huffing and puffing.
Okay.
If you're really out of breath, that means you're overdoing it and you need to slow down.
Okay. Good. That's a good gauge.
Yes.
And then I don't know. I'm wondering, people that want to start, right? I mean, it's like that taking that first step of, okay, I'm going to walk for 30 minutes a day, and I like how you can break it up 10 minutes a time. If you you work full time, if you're a parent, whatever it is that's going on in your life. Do you have any advice on maybe something that someone can do to remind themselves to just take that 10 minutes?
Yeah, absolutely. All of us look for that magic hour when we'll have
And
no
there's
demands
never
on our
one.
time. Yeah,
There's never one magic hour.
Absolutely. As a mom, you understand
It
that.
just doesn't happen.
So looking for that time protected where you can work out is usually hard for all of us. So I would say set aside 10 minutes before you walk into work,
Okay.
10 minutes at lunch, and then 10 minutes before you go home at the end of the day.
That's so good.
And if you are at home, time it to your meals.
Okay.
10 minutes before you have your 3 meals a day is going to get you the 30 minutes a day that we're looking for.
Okay, really, yeah, and to do it before you go home. Because once you get home, all bets are off.
Yes.
Yeah, okay. And then, so kind of this goes into the next question, I think, really well. It's because as moms, like what we were just talking about, and you and I are both moms, but what are some things that we can do as moms to ensure that our family, not just ourselves, but that our family is more heart healthy?
Yeah, absolutely. You know, as we talked about, one of the risk factors for heart disease is a family history. So we sort of owe this to our children to be as healthy as we can. Imagine how wonderful it would be if our children could say, no, there's no heart disease in my parents.
Right, yeah.
And that's a gift that then they could carry along with the tools for eating healthy and having regular activity in their lives that they could then carry through their life and prevent heart disease in themselves.
Yeah, like a trickle-down effect.
Absolutely.
Yeah, I really like that. Thank you so much. I learned a lot today. It was really enjoyable. Okay, and we have another question. Looks like a couple, maybe.
Three questions. Those for
oh,
the end.
Good. Thank you.
So we're going to start with Janelle.
Okay.
And a little bit of information about Janelle that she shared with us. She said today her blood pressure was 168 over 90. She feels sick. She went to the doctor. She says her BMI is high and she's going through menopause. She takes medicine for blood pressure and 1 baby aspirin a day. She's 47. She says she's always stressed. She's going to die of a heart attack. She wants to know how to get her triglycerides down. She says they've been in the 750 range.
Okay. So, Janelle, it sounds like a lot going on. In terms of managing the risk factors for heart disease so that you can be as healthy as you can, there is both lifestyle changes as well as medications that you're probably going to need in order to control the blood pressure, control the triglycerides, and to work on a regimen that's going to help you manage your weight in a healthy range so that you can protect your heart.
Yeah. Well, and I think, too, you know, she's stressed. Of course she's stressed. This is a lot going on. So stress, we didn't even talk about stress.
Right.
How is that affecting our hearts? So this is important.
Yeah, absolutely. So stress is recognized as one of the 8 causes of heart attacks when we look at the World Health Organization definition. So definitely the lifestyle that we're leading is impacting our health.
Right.
And stress raises blood pressures. It can raise the stress hormone levels that then keeps blood sugars up. And having those blood sugars up then leads to a reaction in the whole body that leads to blockages.
Exactly.
So both high blood pressure and blockages can be consequences.
Yeah, another trickle-down effect that's not so pretty. So, okay, all right. Good to keep that in mind. And good luck, Janelle. Okay, next question.
Let's go with Pamela. Pamela wants to know what if you have an irregular heartbeat?
Good question.
Okay.
And the difference between that and palpitations, maybe. Talk about
Sure.
that.
So palpitations are just a sensation that the heart is skipping beats. 99% of the time when we study the heart rhythm in cases of palpitations, we don't find any abnormal rhythms.
Okay.
So in a very small subset of people, there is an actual irregular rhythm that we need to treat.
Got it.
The vast majority of times, it comes back to too much caffeine, too much sugar, not being hydrated
When you're
enough.
kind of that shaky kind of, right, okay.
We're stressed, we're not sleeping well, and we're just worrying about things, and that's what's leading to too much stress hormone, and that makes the heart skip beats. And if we mitigated those prompting factors, a lot of the palpitations will go away. Specific irregular heart rhythms that have been diagnosed really need a specialist to help take care of.
Okay, good to know.
And the last question is from Tammy, and she said her father passed away a year ago at age 78 of an abdominal aortic aneurysm. She wants to know if that puts her at risk for heart disease or if it's a random condition that just happens.
So, thank you for your question. I'm sorry about your loss. The risk for abdominal aortic aneurysms is known to be higher in men, especially if they were smokers and if they're over the age of 65. Anyone who has a family history of having an abdominal aortic aneurysm should be screened by their doctor, and it's usually a one-time screening depending on their age. If you're really young, the doctor may want to repeat it in a few years' time. So I would say definitely a conversation with your doctor, please.
Yeah, good to know. You know, we didn't even discuss treatment. I was so interested in learning all about everything else we were talking about. But yeah, so now I think we probably need to talk about treatment a little bit, and if you are, if you have heart disease, what the options are.
Absolutely.
Okay.
So in terms of managing high blood pressure, really we want each and every person to make certain lifestyle changes in terms of what they eat and how active they are as the first step. before we get them started on medication.
Okay.
The reason for being on medication is because we want to prevent secondary effects on the rest of the body.
Okay.
And so we don't want the blood pressure to be too high for too long before treating it. And once we've done that, it's important to keep it in range. So if you're doing well and you've started to lose weight or eat healthier and your blood pressures are lower, have a conversation, because you may not need to be on as much medication. So it isn't like, now that I'm on medication, I'm going to be on it for life.
Right.
It is something that can change if things are doing better.
Okay.
It is important to keep an eye on it. You don't want to come off of medication and let the blood pressure come up again.
Got it.
In terms of treating blockages, really there are a couple different ways that we treat blockages. The main one would be for the doctors to go inside the heart. So we go in through the artery in the wrist or the groin. This is known as an angiogram. And we take pictures of the blood supply to the heart, which is these 3 arteries. And if there is a blockage in one spot or 2, we can put a wire through it. It's sort of like cleaning out a kitchen pipe, because we are talking about plumbing. And we put a balloon on it to crush it out of the way. This is known as an angioplasty.
Got it. Okay.
And if they do that, they leave a metal spring in there to hold that artery open from the inside. This is known as a stent.
Right.
So that's one option in certain situations, which can be done at the same time as taking the pictures. So it's sort of a combined procedure.
Okay.
Sometimes there are too many blockages, and then in that case we would recommend open heart surgery to reroute blood flow to the heart.
Okay. What about things that you should talk to your doctor about, as far as the procedure that you might need, right?
Yes.
Concerns that women might have, or things that they should think to ask before any of those treatment plans that you just talked about?
Yeah, I think the main important things are what different options are available, if there are alternatives, and if there is any specific risk to them in particular from one option more than another.
Got it.
And specifically, what is the recovery time, and what kind of precautions do you need to take long term?
Yeah, okay. All good questions. And also, I think we can put the website up there too, which is, you probably already did it. Okay, kp.org/cardiac/Northwest. Dr. Kansal, thank you again so much for being here from Kaiser Permanente Northwest. Any last question?
Yes, we have
Okay,
one last one.
that's
that
good.
just
Let's
came in.
end it on a question. Yeah.
Michelle asks, she says her husband had open heart surgery 4 years ago. He's now in heart failure, fighting stage 4 pancreatic cancer. She wants to know, what is the risk for her granddaughters?
Wow. So sounds like a lot of things to deal with.
Yeah.
In terms of the heart issue, the risk factors would be for the children, and it would depend on the age of onset of heart disease. And usually we would want the children to start looking at the risk factors at least 10 to 15 years prior to onset of disease. And in terms of the grandchildren, again, it would depend on whether the parents had the disease or not.
Yeah. Okay. Good questions. Yeah, all good questions. Thank you, everybody, for joining us today. Thank you for being here. Thank you.
Thank
again.
you.
Really enjoyed the lesson. Appreciate it very much.
You're
All right,
welcome.
everybody. See you next time.
Thank you.
Yeah.